Like the last session, I will sort of respectfully apologize to you all for getting delayed but I am extremely excited for this panel and you all know this that we have already discussed, set up the bar that what is the objective of this one. And most of these has come from the experiences that we have faced and the mistakes that we have made. This is very unique because you all are sitting on the front, observing all the functions, activities of the huge operational stuff that goes out in the running the hospital, and also sort of seeing the what is working and what is not working. You take decisions on whether you should be buying technology or not. You take decision on whether this is something suitable for you or not. Just to highlight this, so two of them, Dr. Sambit Ji is the CEO of Ruban Memorial. Mr. Bhanu Pratap is the co-founder director. Mr. Varun is CTO of Medkart. Medkart is India's largest generic medicine omni-channel network. And then we have Siddhartha Shankar, who is the founder of Humantics AI. So again, I would like to keep this open discussion that when the 60% of entire India's healthcare delivery are through these SME hospitals bed with less than 200 or less than 400, why there is no suitable, affordable technology solution and what can we do about this? So, would like to understand open this one. I'm not questioning anything. I'm not going to ask anything. Why? I mean, you should be telling that, look, this is a problem we need to solve and we are here to sort of build up that one. So this is the what I have opened the floor. Let's discuss. Starting from Dr. Sambit.
Okay. Good evening. I believe we have reached the evening part of it. So, SME, small or mid-sized hospital are basically less than 200. Most of the hospitals in India, they are 50-bedded, 100-bedded community hospital. If you are at 150, 200, you are a little bigger, but it's still a mid-size. And what happened is, majority of the time, or rather in the past, like Dr. Satya is saying, it's the doctors who start the hospital. So, fund management and things goes little kind of on the query side. Investing in something which automates certain things have never come. I'll just go a little back. I was speaking to Dr. Shah. What technology people right now have, there are so many of you now interested in this class, willing to have a career in AI and all. 10 years back, I was struggling, I was with Fortis, struggling to have a predictive score for cardiac disease. My cardiac surgeon was searching for somebody to help out. No fund, no money, Fortis gave a certain amount. Only TCS came up with, because Ratan Tata created something like a talent hunt, I'm forgetting that thing, which invests in such things. They helped us out. We had one of the earliest predictive score of a cardiac patient or whether he will be undergoing a heart attack and all. It was in the primitive stage. Now things have improved. Apple has come up with watches. There are many more things have come up. The sensitivity has gone up to almost 90-95%. So things have improved. But initially the niche investment is required for such thing is something was a constant, still is. But with last 10 years, I believe, this this startup ecosystem building up, it is catching up. The prices have come down, number of talented people ready to work on have increased. So the future is bright.
Awesome. Next, Mr. Bhanu Pratap. Just to add you that we know each other for almost a year. And so when I was not doing any hospitals in Patna. I reached out to him on LinkedIn. We connected. We got a pilot. We did that pilot, and I can tell you, even though we could not satisfy the deliverable part, but the learning that gave me allowed to build what we are building and the confidence that we got. So, thank you for that, and we would love to understand the discussion from you.
Sure. Thanks so much. Hello everyone. Just for a bit of a context, let's get into healthcare services. Now, healthcare services started long before technology, right? But the modern medicine that we know of today, I wouldn't say it's more than 150 years old. Even 150 years ago, a practice called bloodletting was very widely used. If you don't know what bloodletting is, I would request you to just do a Google search and you will be amazed. I think that used to happen even 120 years ago. Now coming back to healthcare in the modern times, with the Indian context, private sector hospitals, private sector healthcare service delivery is still a pretty nascent industry. I think in the late or mid 1980s, Apollo started, and then after globalization, all the other hospitals came. Now consider this as compared to the other industries that we know of in India, let's say the banking industry, even the IT industry. So these were much older. So every industry has its own maturity curve, right? So we are still private sector healthcare hospitals still have a maturity curve to climb as compared to some of the other industries, and with this technology ingress will happen more and more. Second thing is that it's a very defensive industry in the sense Mr. Khalid had also mentioned it. It's based on a lot of human intervention and there is a lot of information asymmetry. What the doctors understand, it's very difficult for the patients to understand. It's very difficult even for healthcare administrators like us who are non-medicals to understand. So whenever there is a lot of information asymmetry and a scope for human intervention, people are usually defensible. Trust deficit is very easy to creep in. And whenever that is there, you need to be 100% sure of what technology you are using, in case there is a new technology that is being adopted. From a clinical side, you need to be 100% sure that it is going to lead to the right patient outcomes, because that trust deficit is very easy to come into the play and information asymmetry is there. And that's why coming to the topic in today's world, and again talking about mid-sized private sector hospitals in this region, traditionally the IT spend has not been much. It's always been related to, let's say, the doctors, patients, medicines, and slowly the medical equipment industry has evolved. But technology, the way technology that we are talking about today, AI or something, automation, that IT spend has not happened over the past few years, but that is now started happening. Another thing that we need to understand that every technology is not AI, right? So when we talk about this region, having a simple, good healthcare information management system itself is something not every hospital has. AI comes in after that. If you jump into AI without having the basic technological infrastructure, it's only going to add to the information asymmetry and it's only going to add to the opacity. So definitely it's time, it has come, its time will come, and with every year we'll have excellent advancements in technology, but we need to be very careful. From a clinical side of view, I see hospitals continue to be more defensive, but from the operations point of view, there are immense value to be added. And we are already doing that, many hospitals are already doing that. Still there are pain areas, issues where entrepreneurs like you can pitch in, bring in solutions which the hospitals will be very happy to use. That's it. Thanks.
Varunesh, how are you? Sorry.
So, yes, I mean, what two of you mentioned from the hospital perspective, another thing is from the technology perspective as well. So, the lots of software that we are using nowadays in hospitals or in the healthcare system itself is not designed for the India person. It is designed for some other environment, and they haven't deal with a single day in a facility itself while designing those softwares. And in India, basically, healthcare is not a process-driven thing. More humans are there, It is an exception driven thing. So the information that you are gathering for some processes is quite different from the information that is you are gathering at the billing level or at some reporting level, or the repetitive data is getting gathered at different levels. So this is one thing that many of the other speakers has told. First, you need to understand the requirement. Live one day in a facility to understand their requirement, what they actually deal with. Like we have software for the expiry management and everything in our pharmacies and in our hospitals. But if we are capturing the batch data itself wrong at the entry level, all the intelligence that we are driving, whether it's from AI, from the data intelligence and so far, is going to be wrong, right? So this is mainly exception in the process driven thing. You must have to understand the processes as well as the knowledge of the ground workers and the process of the ground workers, how they are working on it. You have built a form which is not able to, the ground workers are not able to understand what they need to feed into that form. Then you are just, this software is just being a burden on their head just to comply with it. So a software, without leaving a facility, without keeping in mind the ground workers, their knowledge, their way of working, if it is going to be implemented in a healthcare system, it is not a solution, it's just a burden.
Varun, sorry, just to add this, you are CDO.
Yes.
You do and take such decisions. You build this kind of technology. How do you think? How can you solve it? I mean, what are your thoughts on that?
So see, at Medkart, when we were identifying the technologies, what we need to use for the retail chain, where we have so many stores, I think we have more than 120 stores in Gujarat and Rajasthan. The one mantra was, we went for the vendor-based softwares, and we identified that these softwares are not meant for us. We started understanding the gaps in the softwares that we had already. We tried to understand the knowledge level of our ground workers and the processes where we can actually implement software. So this is the very fundamental thing. At one point in time, we started solving one solution, and we start looking at the solution that we have implemented repeatedly, whether it is still error-prone thing, whether it is solving the solution that we have built for. And we repeatedly improve the efficiency of whether it is a money leakage kind of a thing is happening, whether it is not following the processes, whether we have moved from one process to another process, and now we have to implement this one. So gradually, every single day, we basically try to understand what we have implemented and how can we improve it for the ground workers.
Please, Mr. Siddhartha Shankar. Yes. Founder of Humantics.
No, so already everything has been said actually, and it's very rightly pointed out that the whole India has such a diverse need, right? So every hospital you go, like you go from one city to another city, there is a different culture, different setup. Then in terms of hospital size, you see there are, like, if you go to a very premium hospital, you can probably get better care than you get in the US. But we have hospitals where we don't even have a single computer. So how can you build one system which can serve all, right? So that's a very, very important aspect, that we have to understand the real need of that particular geography. And then only we can build something which basically works for them. And technology spend is another thing, like, like we have again such a diverse, economic zones. Some hospital can spend probably 1,000 and some hospitals probably spend only 100 rupees. Now how can you sell them a software which basically has a premium package, right? So now that's where the problem is. So how do we solve this problem with one solution? No, we cannot solve it by one solution, but yes, there are now with the technology advance. And if you look at now, we have cloud computing, which basically does not require any infrastructure to be in place, yet you can have the best software. And we are all using it. But healthcare, it requires little time to penetrate, right? Healthcare is very conservative and it has to be conservative, right? Because they are dealing with life. So that's why we have such a compliance part here. So the challenges are multifold, but there are solutions, and with the invent of AI, but again, I downplay AI, even though we are also AI startup, but I downplay AI. AI can do something only when you have the basic fundamentals, right? If we don't have your data organized, even today, what AI can do? Be it your health data, be it your billing data, be it your administrative data, but we don't have a single repository of the data itself. So yes, we are making good progresses, and with the latest technology, and of course hospitals will be able to gain some trust with them. And as we said, operational efficiency can be improved, which is a quick win, and then probably we can slowly get into clinical interventions. So yes.
In today's world, what was happening also before, if you think globally and you can act locally, solutions, the problem, if you have identified the solution you worked out, there are going to be buyers, or there are going to be people who are going to take it up. So, as Bhanu was pointing out, operationally, there are other areas. One need not be fearing to enter into the clinical part. You need to have a subject matter expert in that while you are working on it. 6-7 years back, Johns Hopkins, USA, started something on predicting readmission of a patient. There they have Medicare, Medicaid who sponsor the patients, or rather back up the patient. So each time there is readmission and all, there is a burden on the system. So they created on 30 parameters how to predict whether this patient I am discharging today is not going to get readmitted within 30 days. So they took most of this study, it is something you can Google search it, called PARR 30, so 30 parameters. They could have done it only in USA. So they were thinking of that, since there are mixed crowd, they also took some expert from China. I was picked up from India, and somebody was there from Medkart. From Africa, North Africa, somebody was picked up. To pick up the crowd there and to have a particular idea. That was done, funded by you think that there is a huge fund going on it, but they thought of it from their point of view, not just Johns Hopkins. They thought of it, this can be taken beyond. Although there is a premium charge on that, we cannot afford that. For India, price becomes a sensitive matter, but a smaller thing, simpler thing, if you look at the solution, with so much of ecosystem built up, people can integrate and all, come up with, it becomes economically viable, because we have a population base 1.4 billion. So where the ticket size do not have to go up, you can have a smaller ticket size, the population is going to gather and going to refund back the money invested.
We are definitely short of time, but I will take this quickly. So when I sit outside and think as a startup founder, also not owner but then more startup founder. So I look at a hospital and say, okay, so they have revenue source from treating patients, okay. They could have revenue source data. So then I look, okay, data monetization will happen later, so they might not be interested. But when I think from long-term point of view, I also think the fact that if they can have the control on that one, it will give them the edge over the competitors in future. So quickly give us this, that do you value data? At what extent? And how can we as a startup sort of come and then help you sort of gather at a scale that can be utilized to build AI softwares, AI solutions, and that also help in improving the bottom line, because ultimately it's capacity the revenue source. Please.
One of the biggest buyer of the data, or rather analysis of the data in future, would be the insurance company. Here in India, the penetration is very less, but in developed country, it is very much more. Since government is spending a good amount, they are going to come up. All your data analysis helps them to select their premium on certain class and certain things and all. So each one who is working on those data, they will be buying those data from us, and that will improve further. It is not that one time done and it is gone. So data is really valuable, and many clinical research. For example, COVID, 8 vaccines came up in 2 years' time. Is bioinformatics at its best. Plus this data helps out. Tomorrow I can get a vaccine in 2 months' time. So data is valuable.
Absolutely, data is valuable. In fact, it was valuable earlier as well from a compliance and audit perspective. Now, from an analytics and product perspective, also it's becoming very, very important. Data can be used in many ways to create new products. A lot of clinical trial data can be used. Government has a lot of emphasis on with the DPDO rules now. Government has a lot of emphasis on data security and all. But monetizing that data is possible, extremely important, and every progressive hospital is seeing that. Right? The challenge is that the systems are broken. There is a lot of data, a lot of insights can be harnessed out of it, but currently it's not happening. Especially I'm talking about the mid-sized hospitals in this region. There are so many different opportunity sets which I can see every day, almost every day, where startups can come and create something valuable. In the interest of time, I'll just take one example. There's something called booking the revenue. When a patient gets discharged, we book the revenue. But the money, whenever the money actually comes, maybe it comes after a month for insurance patients, or maybe it comes in advance for planned surgery sometimes. That's the collection part. Every hospital faces this reconciliation problem between revenue and collections, right? And it's a big mess. The finance and accounting department, it's a big headache for them. TPA companies would send their reconciliation reports in different formats. Ayushman Bharat will send it in different formats, and then the finance team, couple of guys will be doing daily manually reconciling which patient का कौन सा पैसा आया है, right? So if the startups can do something in that regard, it looks very simple, but it's actually a lot of value added.
Awesome. Varun.
Definitely, data is the oil, new oil. We can say that. Earlier, oil was the thing. Now, data is the thing at every level. Accounts is basically reconciliation, and accounts is the key. Not extra monetization, but the current what we should get it from the system itself. These are the leakages in the system that can be fixed. At Medkart, we have a different kind of approach. We go data first. We capture every possible data that can lead to some kind of intelligence while processing that data. So whenever we are having a conversation, let's say if some customer is coming at our store and they are talking about some medicine, and if the medicine is not there, it will automatically flag. It will automatically flag our warehouses that this medicine is getting stocked on so many stores, and this medicine is not in our inventory. So the voice-based system that we are using, data is everywhere. So at physical store or the hospitals, we lot more take care about the LFA, look, feel and ambience. So whether this part of the hospital is looking clean or not, every day it is getting cleaned or not, everything this is getting captured with the CCTV camera. We run the analytics on top of it, whether my staff is wearing the apron or not, whether he is looking at the mobile or not, actually greeting the customer or not. So these kind of data we need a lot more process, and we give this data as an intelligence to our AOMs, area operational manager, to our ops team, to our warehouse team, on the very first hand itself. And we actually looking for some kind of integration we are doing by our own, but we cannot do a lot of things. We encourage startups to come in and help us with these kind of a solution.
Awesome.
Data is absolutely the key of everything we are doing. And in the age of AI and with the fast analysis, it has become much more useful than it was ever, right? So now, and every hospital, if they, I mean, just any data you look at, now it is so much possible. Like for example, and it can be converted into revenue, it can be converted into intelligence, it can be converted into quality enhancement. So data can be used for XYZ, like especially quality and revenue is the key. And another thing in data is medical imaging data, which is very, very important. And I don't think people have realized it is being dumped. I have seen some places. Radiology data is the key because AI is another best use case of AI is in radiology. And the radiology data nowadays is being smuggled. So yes, we need to really have some good, DPDP is a very good intervention by Indian government, and I hope to see that it is getting implemented everywhere.
Awesome. Thank you. So just to add this, I can talk to them entirely, but unfortunately we had already messed up few hours, so we have to sort of close this session. But thank you so much to all the panelists. Again, the objective was to sort of bring all of us think that how can we sort of have our advantage in this ecosystem, and we look forward to our collaboration below this dais, beyond this campus and across one. So a huge round of applause for all of them.